Hi everyone, welcome to our channel New Roots Hair Transplant Center. I am Dr. Shraddha Katkar, consultant dermatologist, New Roots, Nagpur. So today we have with us a 27 years old male patient who came to us 3 years back with a complaint of hair thinning. The family history of baldness was there. He presented to us with male pattern hair loss grade 3 with frontotemporal thinning. The grade of baldness was stable. We decided to take him for hair transplant. We did his transplant with 3500 graft, and post-transplant he was started on topical minoxidil lotion and oral DHT blockers along with some nutritional supplements. He has been regularly following up with us since then. The progressive baldness in young patient in mid-20s is difficult to negotiate. It's because of mainly the hair thinning is still progressive, and second, the young patient have really high expectations due to peer pressure. In such cases, we have to plan a strategy for long-term treatment. First, we have to stabilize the hair loss by correction of the nutritional deficiencies and hormonal imbalances, if any. Also, by starting them on the DHT blockers like finasteride or dutasteride and topical minoxidil lotion. Even while taking such patients for hair transplant surgery, we have to keep in mind that hair transplant is a static treatment which is going to replace only the lost hair, and it is not going to prevent the existing hair from falling out or shedding. That's why we have to use donor area wisely. We have to align the patient for the potential of the future surgeries. Also, we have to develop the hairline in such a way that it should look age appropriate, as the hair transplant is intended to be permanent. Also, we have to design the hairline in such a way that it should look age appropriate even in their late 30s and 40s, as the hair transplant by FUE is intended to be permanent. Thank you and stay tuned.